PCOS is a problem with the hormone levels that affects some women during their childbearing years ages 15 to 44. PCOS affects a woman's ovaries, which in turn imbalances the estrogen and progesterone production, hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormone called androgen. Women with PCOS produce higher than normal amounts of the male hormone androgen. This hormone imbalance causes them to skip menstrual periods and makes it harder for them to get pregnant. PCOS also causes hair growth on the face and body, baldness, and it can contribute to health problems like diabetes and heart disease. In PCOS, many small, fluid-filled sacs or follicles, each containing an immature egg, grow inside the ovaries. The eggs never mature enough to trigger ovulation. Extra male hormones disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. PCOS' three main features are: 1. Cysts in the ovaries. 2. High levels of male hormones. 3. Irregular or skipped periods. PCOS types. Diagnosed with PCOS. Knowing what type of PCOS you have can drastically change the way you be treating it. 1. Insulin-resistant PCOS. This is the classic type of PCOS and the most common. High insulin and leptin impede ovulation and stimulate the ovaries to make testosterone. Normal weight insulin resistance can occur in the years following dieting or eating disorder. 2. Pill-induced PCOS. Hormonal birth control suppresses ovulation for most women. The slow to restart period after stopping the birth control pill will normalize within the first 6 months, but some require treatment. 3. Inflammatory PCOS. Chronic inflammation from stress, environmental toxins, intestinal permeability, and inflammatory foods like gluten. Inflammation is a problem because it impedes ovulation, and or other hormonal imbalance that is interfering with your body's ability to ovulate on a regular schedule. Once that single thing is addressed, this type of PCOS resolves very quickly. Causes of PCOS: genes, insulin resistance, and inflammation have all been linked to excess androgen production. Genes studies show that PCOS runs in families. It's likely that many genes, not just one, contribute to the condition. Insulin resistance is caused by obesity, sugar intake, smoking, trans fats, and environmental toxins. What causes it? Insulin-resistant PCOS. Insulin resistance is caused by obesity, sugar intake, smoking, trans fats, and environmental toxins. Pill-induced PCOS or post-pill PCOS. You had regular periods before starting the pill, although you may have had acne. After years of the pill hijacking your hormones, the body has a hard time producing its own estrogen and progesterone again, making ovulation natural or non-existent. Inflammatory PCOS. Women with PCOS often have increased levels of inflammation in their body. Being overweight can also contribute to inflammation. Biomarkers such as vitamin D deficiency, abnormal blood count, elevated CRP, thyroid antibodies, or gluten antibodies. Hidden causes PCOS. Common hidden causes of PCOS include intake of too much soy, as it can block ovulation in some women. The thyroid disease, because it causes thyroid hormones imbalance and your ovaries need B3 thyroid hormone. Vegetarian diet, because it causes zinc deficiency, and your ovaries need zinc. Iodine deficiency, because your ovaries need iodine. Artificial sweeteners, because they impair insulin and leptin signaling. Symptoms of PCOS: acne, straight hairs, weight gain, and period problems. A condition called polycystic ovary syndrome may really be behind these problems. The most common PCOS symptoms are irregular periods, unpredictable periods called oligomenorrhea resulting from lack of ovulation prevents the uterine lining from shedding every month. Heavy bleeding. The uterine lining builds up for longer period of time, leading to periods being heavier than normal. Hirsutism. More than 70% of women with this condition grow hair on their face and body, including on their back, belly, and chest. Women. Acne. Unfortunately, elevated androgens make the skin oilier than usual and cause breakouts on areas like the face, chest, and upper back. Weight gain. Up to 80% of women with PCOS are overweight or obese, although it can also affect women who are thin. Male pattern baldness. Hair on the scalp gets thinner and fall out. Headaches. Hormone changes can trigger headaches in some women. How is PCOS diagnosed? Physical exam. A pelvic exam looks for any problems with your ovaries or other parts of your reproductive tract. Inserting gloved fingers into your vagina and checks for any growths in your ovaries or uterus. Checking of body mass index, waist size, extra hair growth, acne, and discolored skin, which can all happen if you have PCOS. Blood tests. Blood tests check for higher than normal levels of male hormones and to check your cholesterol, fasting insulin and fasting glucose levels, and triglyceride levels to evaluate your risk for related conditions like heart disease and diabetes. Blood tests for inflammatory biomarkers like CRP, BSR, vitamin D deficiency, thyroid antibodies and food sensitivities/allergies should be evaluated. You may also have elevated DHEAS, and adrenal androgen, elevated LH luteinizing hormone and a positive urine test for intestinal permeability. Pelvic ultrasound sonogram. Using ultrasound sound waves to look for abnormal follicles and other problems with your ovaries and uterus may also be done to determine whether you have PCOS. PCOS diet. Reduction of stress and exposure to environmental toxins like pesticides and plastics and elimination of inflammatory foods such as wheat, dairy, and sugar helps in easing PCOS symptoms. 3 diets that may help people with PCOS manage their symptoms are: a low glycemic index GI diet. Foods in a low GI diet include whole grains, legumes, nuts, seeds, fruits, starchy vegetables, and other unprocessed, low carbohydrate foods which do not cause insulin levels to rise. An anti-inflammatory diet. Anti-inflammatory foods such as berries, fatty fish including tuna, salmon, sardine and mackerel, leafy greens as kale, spinach, and extra virgin olive oil, also good in PCOS. The DASH diet. A DASH diet is rich in fish, poultry, fruits, vegetables, whole grain, and low-fat dairy produce. The diet discourages foods that are high in saturated fat and sugar. Treatment of PCOS. Birth control pills, diabetes drugs for estrogen and progesterone daily can restore a normal hormone balance, regulate ovulation, relieve symptoms like excess hair growth, and protect against endometrial cancer. Can help fix the hormone imbalance and improve symptoms. Metformin glucophage. Forte-Met is a drug used to treat type 2 diabetes. It also treats PCOS by improving insulin levels. Clomiphene. Clomid is a fertility drug that can help women with PCOS get pregnant. Surgery can be an option to improve fertility if other treatments don't work. Ovarian drilling is a procedure that makes tiny holes in the ovary with a laser or thin heated needle to restore normal ovulation. pregnancy and PCOS. The infertility rate with polycystic ovaries is very high, as PCOS interrupts the normal menstrual cycle and makes it harder to get pregnant. This condition can also increase the risk for pregnancy complications. Women with PCOS are twice as likely as women without the condition to deliver their baby preterm birth or prematurely. They're also at greater risk for miscarriage or early loss of pregnancy, preeclampsia, high blood pressure, body swelling after the 20th week of pregnancy, and gestational diabetes during pregnancy, which can lead to large babies and C-section delivery. If you have PCOS and getting pregnant is your dream, there are some treatments that may help you bring home the baby. Fertility medications. Fertility drugs may help temporarily with ovulation. One disadvantage is a developing follicle may take up to 3 cycles to grow and mature, which may result in a poor quality egg. Metformin. Metformin, also known as glucophage, helps to lower insulin levels and helps in easing PCOS symptoms. IVF. In vitro fertilization (IVF), another option for getting pregnant with PCOS. Ovarian drilling. The type of laparoscopic surgery referred to as ovarian drilling involves puncturing the ovary with a small needle, destroying a small portion of the ovary. The procedure can also comes with the risk of developing scar tissue between the fallopian tubes and ovary and other problems that can hinder your ability to get pregnant. Natural PCOS fertility aids. By maintaining the healthy diet, you can improve your body's use of insulin and balance your hormone levels, lower androgen levels, and thereby improve your fertility. Weight loss and PCOS. High insulin levels increase the production of male hormones called androgens, which lead to symptoms such as body hair growth, acne, irregular periods, and weight gain. Thus, women with PCOS face problems associated with weight gain, including type 2 diabetes, high cholesterol, high blood pressure, sleep apnea, infertility, and endometrial cancer. Also, losing weight can become a problem, but by limiting junk food, exercising regularly, as weight loss can help to regulate your cycle. Measuring your portions, drinking more water can help reduce PCOS symptoms. Diabetes and PCOS. Polycystic ovary syndrome. PCOS is a hyperandrogenic disorder that is associated with a high risk of development of type 2 diabetes mellitus D2D. Type 2 diabetes occurs when the cells of the body become resistant to insulin. An abnormal amount of insulin is made. For both PCOS and T2D are both obesity-related conditions that share insulin resistance as an important pathogenic factor. High-fiber foods can help combat insulin resistance by slowing down digestion and reducing the impact of sugar on the blood. Options for high-fiber foods include cruciferous vegetables, such as broccoli, cauliflower, and Brussels sprouts. Greens, including red leaf lettuce and arugula, green and red peppers, beans and lentils, almonds, berries, sweet potatoes, winter squash, pumpkin. Research shows a significant contributor to inflammation comes from your diet. Avoid foods. 1. Foods high in refined carbohydrates, such as white bread and muffins. 2. Sugary snacks and drinks. 3. Inflammatory foods, such as processed and red meats. Remedies to cure PCOS/PCOD naturally and fast. Remedy 1. Drink brinjal or add plant leaves tea. Remedy to drink honey, cinnamon, and licorice tea. In 1 cup of water, add 1 cup of cinnamon, 1 cup of licorice. Cook for 5 to 7 minutes. Strain and then add 1 spoon of honey. Use 1 hour after your meal. Remedy 3. Take psyllium, carom seeds, medula seeds, and fenugreek in equal portions. Grind and mix the ingredients. Use 1 pinch in the evening and the evening on an empty stomach, and take your meal after 20 minutes of using this remedy. Remedy for take fenugreek, dried bitter gourd and black plum seeds tea. Grind, make the tea and take twice in a day, morning and the evening. If you liked the video, please subscribe, like or comment.